Did you know that more than 16 million Americans are living with a disease caused by smoking? Over 700 chemicals in tobacco are known to cause cancer in people or animals. Cigarette smoking is extremely deadly. It affects nearly every organ in our body, but most prominently the cardiothoracic system. Cigarette smoking is most responsible for lung cancer, coronary heart disease, and chronic obstructive pulmonary disease, also referred to as COPD. According to the Center for Disease Control and Prevention, a whopping 87% of lung cancer deaths are due to smoking. Cigarette smoking is the number one risk factor for lung cancer in the United States. When you inhale cigarette smoke, it is full of cancer-causing substances called carcinogens, which create changes in the lung tissue almost immediately. At first, your body may be able to repair this damage, but with repeated, continuous exposure, normal cells that line your lungs are increasingly damaged. There are two types of lung cancers, but small cell lung cancer occurs almost exclusively in heavy smokers and is less common than the other type, non-small cell lung cancer. Statistically, people who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from lung cancer than people who don't smoke. According to the American Lung Association, between 2005 and 2010, an average of 131,000 Americans with a 3-to-1 ratio of men to women died of lung cancer that could have been attributed to smoking each year. In addition, non-smokers have a 20 to 30% greater chance of developing lung cancer if they are exposed to secondhand smoke at work or at home, as they are put at the same risk to all the things traditional smokers are. Cigarette smoking also negatively impacts the health and the functioning of our heart. Cigarette smoking leaves a variety of adverse effects on our heart and contributes strongly to the development of coronary heart disease. Cigarette smoking, specifically nicotine, increases blood pressure and heart rate due to the fact it narrows the arteries and hardens their walls. It also decreases exercise tolerance, as difficulty breathing, and it creates an effect on the respiratory system. There is also an increase in the tendency for blood to clot, which sets you up for heart attack or stroke. Chemicals in cigarette smoke can damage the lining of the coronary arteries in the heart, leading to furring of these arteries, making the heart work even harder to pump blood. This damage to the coronary arteries can also result in atherosclerosis, which is the buildup of a waxy substance called plaque in the arteries. This prohibits oxygen-filled blood from reaching the heart, and it limits the flow to the rest of the body. Smoking also decreases HDL, which is good cholesterol, and that's necessary to carry out bad cholesterol and plaque away from our arteries and our liver. The development of CHD, coronary heart disease, can lead to chest pain, heart attack, heart failure, or in even worse cases, death. According to the American Heart Association, about anywhere from 23,000 to 70,000 premature deaths from heart and blood vessel diseases are caused by other people's smoke each year. In addition to coronary heart disease, smoking puts you at an even higher risk to develop COPD as well. Smoking is the leading cause of chronic obstructive pulmonary disease, also referred to as COPD. Smoking damages the air sacs, airways, and the lining of our lungs. Injured lungs have trouble moving air in and out, so it's very difficult to breathe. People with COPD have less air flow in and out of their airways for one or more of the following reasons. The lungs, airway, and air sacs can lose their elasticity. The walls between the air sacs can be destroyed. The walls of their airway thicken, become swollen, or the walls make more mucus than normal, which clogs these airways. Smoking can also account for another whopping 9 out of 10 COPD-related deaths. COPD can also include emphysema, chronic bronchitis, and in some cases, asthma. Emphysema can cause shortness of breath and wheezing, while chronic bronchitis results in thickened mucus in the lungs. Asthma can include all the previously mentioned symptoms as well as chest pain. Cigarette smoking is detrimental to the health of our respiratory and circulatory systems. Cigarette smoking is responsible for lung cancer and heart disease, coronary heart disease, and chronic obstructive pulmonary disease. Cigarette smoking causes a profound amount of damage to the cardiothoracic system and can yield many diseases and cancers as it affects millions of people each year. These millions of cigarette smokers in America are living with a variety of these diseases caused by cigarettes by themselves.